before the end? Testing 1, 2, 3. Hello, I'm Dr. Stephen Blomerth, and you're watching Natural Health Today. Our show is about natural means for you to regain your health and to find a solution to your pains or problems. And we actually talk about different ways that you can help yourself, help a friend or a neighbor or a loved one. And we invite you to participate in the show by sending in your questions to us. And there's 3 different ways you can send in your questions. You can send an email to our office address, which is pubertychiropractic@gmail.com, or you can telephone my office at 978-535-6155, or you can even send an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts 01960. But whichever way you choose to participate in the show, what we'll do is slightly disguise your name so your friends and neighbors won't know exactly what kind of health inquiry you're making. And what we'll do is we'll talk about natural health means to help you get better. And this is what I mean when I talk about natural health. I think there's 4 basic avenues that we have in natural health. One is manipulation of joints that are stuck. This can be a key to helping people with problems of pain, posture, and even some problems they might not even think would be related to joints, such as asthma. Another means of helping people is through muscle trigger point therapies. This is not the same as massage. This is specific work on muscle trigger points, because muscle trigger points, for instance, is one on the back side of your shoulder that can give you pain all the way down into your wrist and hand. And you wouldn't think that a wrist or hand pain would be emanating from a shoulder trigger point, but it can be. So we look for that. A third way of helping people is via exercise. And this is not through standard exercises that you might get at a gym or some stretching exercises that a friend might have shown you. These are through what we call stabilization exercises, these core strengthening exercises that we've learned through foundation training. Foundation training helps work on the little muscles. Is it some stretching? To some degree, there's some stretching involved, but the best strengthening programs are a combination of strengthening and stretching. Stretching on its own is doomed to failure, but a program that stretches certain muscles while automatically strengthening others is the real key way to go to good posture and to gain stability. And the 4th avenue of natural health care is just as important and long-term maybe the most important factor in your life, and that's good nutrition. Nutrition is more than just learning what to eat and what not to eat. It's learning how nutrition can help you much more than supplements to foods, because a lot of people say, well, I'll eat poorly, but I'll make up for it by taking certain dietary supplements. A supplement should only be what its name is, to supplement an already good diet. And an already good diet will keep you within the weight range that you're supposed to be in, and make sure you have enough energy for the day, have healing power, and if you have certain conditions like diabetes, Nutrition is the only way to cure diabetes, that's type 2 diabetes, by making sure that you're not eating certain foods which will keep your diabetes raging. Some people say, well, my diabetes is under control. Well, if you're having to take metformin or glyburide or any of the blood sugar lowering drugs, including insulin, you are not healthy, and you won't be healthy, and you won't continue to be healthy until you're off all those and you have the carbohydrates decreased in your life. So I'm going to put on my reading glasses and we'll have a look at some of the questions that have come in since our last episode. Okay, our first question is actually a question that we didn't finish in our last episode. It's from Stephanie, who wrote in from Danvers. She said in her last episode, I had to move a bunch of heavy tables 2 days ago at work, and now my low back is hurting. My medical doctor saw me yesterday, and he said he thinks it's just a muscle pull, and it'll go away on its own. But it still hurts to get in and out of the car or out of a chair. How can I be sure if it's, quote-unquote, just a muscle pull? Well, you can't tell on your own whether you have a muscle pull. I know many of my patients say, I know what my problem is. It's, quote-unquote, just a muscle pull. And how they know that is beyond me, because I don't know that until I examine you. And almost always, there are several different factors at once. People say, it's just a muscle pull, or it's just this, or just that. Most of our problems are not singular in nature. They're a combination of several things coming to a head. When people have pain, they usually don't get it in a dramatic fashion. Now, a dramatic fashion to me is you're in a car accident, or you fall down a flight of stairs, or you're playing a touch football and somebody sideswipes you and knocks the wind out of you. That type of trauma, extremely rare. Some people have it, most people don't. Probably the biggest thing I've seen in 37 years of practice is people say, I don't know how I got it. I just woke up one day and I had it. They didn't do anything special. So what that tells me is there's 1, 2, 3, maybe even 4 different factors in that life that gradually led them to having that pain and that problem. The pain and the problem might be felt, say, on a Monday morning, but long before that Monday morning came along, a person had the problem that only slowly became to the fore on that Monday morning, but it was ongoing for a long time beforehand. So how can you tell if it's only muscle? You can't, because most people's problems are a combination of a muscle being overly tight or being overly weak, and other muscles being overly strong. And so what we try to do is figure out which muscles are involved, where the trigger points are, and we look at a person in many different ways. We look at, are there joints in their spine moving properly? Are there joints in their feet working properly? Because when a person has low back pain, I actually don't even start my examination on the person's back. I start at their feet, because the feet are your foundation. So if you have a problem with your feet, whether you have an overly high arch, an overly low arch, or you have a short leg on one side, I'll look at all those things to help see what combination of slight variations does that person have that all need to be fixed in order for that person's pain, that person's symptoms to go away. So Stephanie, I hope that gives you a little bit better answer. It's impossible to tell if it's, quote-unquote, just a muscle pull, because usually it's several different factors all rolled into one. And what is your medical doctor going to do for you? Well, he'll probably either give you some anti-inflammatories, he might give you some opioids to take, or he might give you something that's called a muscle relaxer, but is not a muscle relaxer. It's actually a central nervous system depressant. Anytime your medical doctor gives you a muscle relaxant, if you look up what's in it and its mode of action, they're always central nervous system depressants. In other words, they knock you out. That's not the cure for anything. So, Stephanie, thanks for that question. I'm glad we had a little bit more time on this episode to more thoroughly answer your question. So, John writes in from West Peabody, and he says, my daughter cannot sit still, The only time she's not moving, fidgeting, or complaining that she has aches and pains is when she's asleep. She barely sleeps at night, but at least she's pretty quiet then. She doesn't do well in school. She can't seem to understand what the teachers say unless she takes ADD and ADHD drugs. But all those drugs eventually stop working, and they just make her feel bad. I don't know what to do now. Her MD just keeps changing the drugs they give her, and they usually work for a few months and then stop working. What do I do? John, that is a major problem, but it's not rare. In fact, it's probably the most common type of problem that people see. What causes a person to be like that? Because medical doctors try to explain it by saying, well, you need more of this drug, you need more of that drug. And many people, and I have a friend whose son is 26 now, he's still in college, he still hasn't graduated. Why? He can't pay attention, he can't stay focused. Is he fidgety? Yes. His mind wanders. Can he understand his teachers in class? He can only understand the teachers in class when he's on these certain drugs, but after a while, the drugs stop working. He can no longer understand what the instructor is saying, and the drugs start making him feel bad. So what is the problem that this person has? Well, we don't know exactly what his problem is, but I can tell you this: when a person doesn't respond to drugs in a good fashion, and this is what I mean by a good fashion, a small dose of the drugs corrects the problem, the person then is able to go off the drugs and the problem goes away. That's what I consider a success. Drugs can be a great help if you have an infection. If you have an infection, you take a drug for a short amount of time, it kills off the invader, kills off the bacteria that's causing the problem, and then you stop taking it. You're not on it forever. Because if you're on antibiotics forever, you know you would have a problem. Same thing with any drug. If you're on a drug for a prolonged period of time, and I'm talking a year, if you're on a drug for that long, that's probably too long, unless you have some condition that is fatal and it's not going to go away. But my friend's son at age 26, he's young enough that he should not have to go on a drug for a prolonged period of time. So how would I treat this patient? I'd give them a dietary diary. I'd see what they eat, because sometimes a dietary diary can not only teach and inform me, it can also inform the patient. There are certain trends that we see when people have these, I'd call them mental imbalances. It's not normal for a person or a child to not be able to understand what the teacher is saying unless you take a drug. So it says something about their brain is a little bit off. So what do we want to do? We want to look at what are they eating. Why? Because there's a connection between your gut and your brain. I think we might have talked about it on our last episode, but it's still true, and it'll always be true. Your gut has a very intimate contact with your brain. This nerve called the vagus nerve travels from the base of your brain, and it travels along the entire length of your gut, and it's constantly testing and tasting portions of what's inside your gut to see, is that the right thing? Is that good for me? And as it does this, some aspects of what's in the gut actually affect the brain. Now, they can affect it for the good. Like when you happen to have a good flora in your intestines, when you have probiotics in there that help make you have good bacteria in your gut, it actually helps with putting out brain chemicals that decrease your stress chemicals. Certain chemicals in your brain are produced when you're in periods of stress. If you have a lot of them, you're always going to feel as if you're under stress. So if you have a good balance in your gut that affects your brain, you'll have products in your brain that, if you have a stressful situation, they calm you back down. There are times in life that we want to have stress. If I'm being chased by a bear up a tree, yeah, I want those stress chemicals because those stress chemicals make your heart pound. They prepare you for what we call the flight or fight reaction. There are times in life that we need to fight. There are times in life that we need to run, to fly, to flee. But that's not all the time, and we should be able to choose which times we react in that fashion. We don't want to have to feel that reaction all the time over every little situation. If you do, you can't concentrate because these chemicals that are put out under stress make your heart pound, and they make your blood vessels have higher blood pressure. If our heart is pounding, we have higher blood pressure, and we're thinking just of running or fighting, that's no way to face day-to-day circumstances that don't require running or fighting. So this gut to brain connection is something that is with us for our entire life. And what makes that work well? Good foods. And unfortunately, many people no longer know the definition of good foods. And how do we find that out? Well, we give them a dietary diet, we see what they're eating, and then we go about changing what they eat. When we change what they eat and they start to feel better and they start to have less symptoms, we say that's what the problem was. Now, I know many people say, well, how come this person had a problem with eating that and this other person had the exact same diet and didn't have that problem? People use that sort of as an excuse to not change the diet. Well, the person who doesn't have those reactions and eats the same diet is lucky, because their particular their system, their body, their chemistry is able to hold off or not have a bad spell from eating things that aren't good for it. Other people, they're more sensitive and they will just have a hard time. You don't have to talk about what's fair. All you have to do is talk about what works. And if you change a person's diet and they start to have less need for ADD or ADHD drugs, or they can totally leave them behind, you start to notice improvements in their behavior, you start to notice improvements in their schoolwork, you start to notice improvements in how they feel and their attitude towards life. So can it be something as simple as changing your diet? Yes. Do sometimes people need to take certain dietary supplements? Well, if you've been bad enough, long enough, sometimes you do. The goal is to be healthy. If for a short time you need certain supplements, so be it. Supplements are just modified foods. They're concentrated foods. Eating right is probably going to be the biggest consideration with a person like our last letter, talking about his son who has a hard time concentrating. And I recommended that to my friend's son, who's 26 and can't seem to finish college. So that's the first line. Is there any downside? There's no downside, because the person has already been through a regimen of several different drugs and they've all eventually failed. So what do you have to lose? Nothing except failure. So losing failure is a good idea. Getting some success behind you, changing what you eat. I can't tell what this person would need or need to exclude without doing the dietary diary. The dietary diary tells us a lot. So thanks for that question. Let's go on to our next question. Shirley writes in from Danvers. She said, I took a light fall while skiing a few years ago, and when I went to get back up, it hurt so bad I felt sick to my stomach. Now my shoulder acts up from time to time if I go to the gym too much. But why did it bother me so much from just a light fall, and why does it still bother me? Okay, surely I've had experiences like that myself. A fall, particularly in a situation like skiing, and which direction you fall in is pretty critical. If you fall backwards, that's not usually going to be as much of a problem as falling forward. In my situation, I fell forward. When we fall forward, our arm has a certain angle, and and when we fall, say if we fall on our chest, which is very common in skiing. You might fall on your chest. The shoulder gets forced back, but when the shoulder goes back, the socket here is very shallow. It's not like your hip. Your hip has a very deep socket, and the ball of the hip joint fits deep into that socket. In our shoulder situation, we have a very shallow socket with just a half of a ball. So when we fall forward and our shoulder gets, say our elbow gets forced back, when our elbow gets forced back, this part of our shoulder comes forward, and it can either slightly dislocate or just pull on and strain some of the muscles. Can it tear some of the muscles? Well, you can judge yourself by afterwards. If you notice that there's sort of a bruise look in the area, if there's a bruise look in that area, that means some muscle fibers were torn. Does that mean you need to have shoulder surgery? It all depends on how intensely it was torn. For most people, no. And if Shirley has made a recovery so that most of the time she's good and only acts up when she goes to the gym too much, it tells me this, that she strained certain muscles, that certain muscles in her shoulder area have trigger points, and other muscles have gone into a protective pattern where they're shortened. And many times people who have this type of injury, they tend to be like this. The shoulders sort of drown forward and internally. The problem with most people is we stand with and walk around with too much forward slouch and too much internal rotation. A lot of people stand with their arms internally rotated. What we want to do is have our arms back. And you can practice that by, if you're standing around, just take your pinky, little pinky fingers, and put it by the seam of your pants. If you do that, you'll be in external rotation, which is a much healthier position than an internally rotated, slumped over position. What does the gym have to do with it? Well, many times when people go to the gym, some of the stereotypical exercises that people would do at the gym might be bench press, or there's this pec flies that do this type of a thing, or push-ups, standard planks. All of those work the pectoralis muscles. Pectoralis muscles are usually way too tight, and they give us that round shoulder posture. So it isn't that we don't need the pecs to have a certain amount of strength. We do need the pecs to have a certain amount of strength, but it needs to be balanced. So you need to work the muscles that do the opposite. And nothing in the gym will work any of the other muscles. I know, I've tried the rowing machine and all those. They don't really work the muscles that are shoulder, what we call retractors, that pull our shoulders wide. That's the position we want it. We want our shoulders to be wide and open, not hunched forward like that. Why isn't your problem better now, Shirley, after all these years? Because you have trigger points in those areas that haven't been found and worked out. It's something that has to be done by hand. It's fairly time consuming. You need a practitioner who knows how to do that. And then you have to be taught the exercises that strengthen the muscles that need to be strengthened and that don't overly strengthen. And that's the problem with many people. They go to the gym and they do certain exercises over and over again that strengthen the wrong muscles. And strengthening the wrong muscles is worse than not working out at all, because many people who go to the gym tend to get these problems over and over again. So Shirley, I hope that gives you a little bit better idea of what happened during your fall, because that face-forward fall on the skis does push your elbow back, makes your socket partially tear or strain the muscles in that area. And they don't have to get better on any particular timetable. They don't have a timetable like you would like 6 to 8 weeks. They can have the problem for years, particularly if you have an ongoing problem with the poor posture, made worse by exercising at the gym and doing the usual gym exercises. Shirley, thanks for that question. Let's go on to our next question. Paul writes in from Middleton. He says, my doc says I need to lose weight and to cut out fats. How come you say fats are good? I say fats are good by comparison to the carbs that most people load up on. Now, can fats be bad? Yes, fats can be bad if they're combined with carbs. In fact, it's much worse. But fats on their own do not make you fat. And a lot of people say, well, sounds like one of those new diet fads. This goes back to over 100 years ago, to 1862. There's a fellow named Banting who was an undertaker, and he was chronically fat. He happened to go to several different doctors, none of whose recommendations helped him. Then a friend of his had just been back from a conference in Paris where they talked about the types of foods that would actually help people who had diabetes. And his friend, the physician, recommended a certain diet that was very low in carbohydrates, avoided beer, avoided potatoes, avoided sweets, and was high in vegetables, and fats were okay, and meats were okay too. But vegetables and fats were probably the lion's share of that diet, and he was able to lose 1 pound per week for, I think, his 38 weeks he was on the diet. And many of his problems, he had a hearing loss, he had some problems with his vision, he had problems going up and downstairs. This is 1862, so this is nothing new. His name is Banting, and to this day you can look up the Banting diet. He didn't invent it, but when he had such good results, he put out pamphlets and he told people about it because it was such a miracle. It restored his life. So if you want to look up the Banting diet, it worked for Banting in 1862. It can work for you today in 2019. Check it out. It's a good idea. That's why I don't talk about low-fat diets. I talk about a good diet that's high in vegetables. You don't have to be a vegetarian. You can eat meat. You just have to stay away from the types of vegetables like potatoes and corn and grains and sweets and beer that'll make you fat. Pizza and beer, well, that's a good way to stay fat and not get healthy. Let's go on to our next question. Eileen writes in from Denver. She says, how can you tell if you have a short leg on one side? My son always seems to lean to his left. I can understand that. I have a short leg on the left myself. How can I tell? Well, I couldn't tell until I had an x-ray done in the standing position. If you go to your average medical doctor and they take x-rays of your low back, you're usually laying on a table. Laying on a table is very convenient for the person who takes the films, but very inconsistent to find out whether you actually have a short leg. When you're standing, when your shoes are off, and you're just standing there in front of the x-ray examination, if one leg is lower than the other, that proves you have a short leg on one side. Can that result in problems? Yes, it can result in an imbalance in the spine. So that's the only sure way. You can't really tell by the way a person looks. You can't really tell if a person leans to one side. The best way to determine if a person has a short leg on one side is to take a standing x-ray. So I hope that'll help you, Eileen, with your son, because sometimes something as simple as putting a shim in a person's shoe can help with straightening out a person's problems. And we've come to the end of our time for Natural Health Today, so I'd like to thank you for watching. I'd like to ask you, if you'd like to participate, send in your questions to our three main avenues. One avenue is by sending in your questions to our email, our Gmail, which is peabodychiropractic@gmail.com. You can telephone in your questions to my office phone number, which is 978-535-6155. You can even send me an old-fashioned snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts, 01960. Whichever way you send in your questions, we'll disguise your name a little so your friends won't know what kind of a problem you or your family will have. And we'll talk about natural health means of helping you get better, because that's the way to help the most people with the least invasive means get better. And 80 to 90% of day-to-day problems don't need drugs, don't need surgery, but will be able to be helped by wise, beneficial natural health means. Thanks for watching. I'm Dr. Stephen Blomerth. Thanks again for watching. Bye-bye.